show. We've got school placement fraud and an investigative piece by the Fourth Estate. We'll have excerpts of that for you. And at noon, and all noon times during the week, we have movie time on GTV. So just imagine you're dealing with your Zoo Soup at noon and also watching these movies. Yeah. So we've got movies for you on GTV from noon, and on weekdays it's from 11 a.m. movie time. So you stick around for that and put it in your diary that when it's lunchtime, lunch and GTV, the Anuani movie time, right? So that's what you want to be looking forward to at lunchtime today. We still got to come with us headlines. We've got something to do with music. We'll be playing for you Stir It Up, the song that is stirring up a lot of controversy after the 7 o'clock sports news. But for now, we are looking at neglected tropical diseases. Today is actually World Neglected Tropical Diseases Day. Yesterday, which was the last Sunday of January, was World Leprosy Day. These are diseases, these neglected tropical diseases affect about 1.7 billion people in 149 of the poorest countries in the world, in Africa, Asia, Latin America. How many neglected tropical diseases do we have in Ghana, and what are we doing to manage them? On today's show, I've been joined by the program manager for leprosy at the Ghana Health Service as we discuss the World Neglected Tropical Diseases Day, Dr. Benedict Okoh-Kwao. Good morning, welcome to the show.
Good morning, and thank you for having us on your show.
It's a pleasure. When you say you deal with leprosy, do people move back?
I don't get that often nowadays.
In the beginning?
But you get the question why, you get the question, is it still there? You know, and those are good questions to have. I mean, it invites us to this discussion, and then we are able to educate and we're able to inform the public. It helps get that collective action, you know, and then also to fight some of the myths that are out there.
Okay.
So yes, we always invite those questions.
Great. What are the major myths around leprosy?
Leprosy. People think leprosy is forgotten, is lost, is gone, right? But it's still there. That's one of the things. People think it's a spiritual disease due to curses and taboos. That's not true. It's caused by an organism which is transmitted from someone who's infected, and that's Mycobacterium leprae. It is curable. Leprosy is curable once we can find a person with leprosy before they have disability. We'll cure them within 6 to 12 months with no evidence of disability. So it doesn't mean that you should have clawed hands or some other deformity for the rest of your life. Yes.
Thank you for that. When we're talking of neglected tropical diseases,
yes.
I'm assuming that leprosy is one of them.
But
there are others as well.
Yes. So there are about 20 varied diseases, mainly parasitic, bacterial, some other conditions, which tend to afflict people living in poverty or situations associated with poverty. And in Ghana, we have about 14 of them prevalent in Ghana. I mean, you have borreliosis, you have yaws, you have leprosy, you have lymphatic filariasis, you have the soil-transmitted helminths, you have schistosomiasis, you have conditions like rabies, they are part of it, conditions like snakebite and envenomation, they are all part of the neglected tropical diseases. And the reason for putting them under the brand neglected tropical disease is to bring attention to them, to bring attention on the global health scene, bring attention to governments, bring attention to health systems, bring attention to partners, so that collective action can go on against these diseases. They tend to affect people and not kill them, but maim them. They disable the affected persons, and these renders them less economically active. This also means that they may have some stigmata that would then predispose to discrimination and stigma from the public. Now, if we really want to tackle poverty, then we need to be looking at these diseases. They affect people in the lower income brackets preferentially, and they render them less economically active. So if we want not to leave people behind, neglected tropical diseases should be a topical agenda.
I'm surprised you said snake bites.
Yes, so it started with about 12 diseases, but over time, some other conditions have been added. So snake bite envenomation is one of, so you can be bitten by a snake, and then because of the venom, some snakes are not poisonous, but many are
I don't know.
poisonous. So that condition where you suffer the effects of the venom, yeah, it is considered one of the neglected tropical diseases.
Wow. And rabies too.
Rabies too. So when we are talking about neglected tropical disease, it's not just related to human beings or human health. We use the One Health approach. We are looking at human health, of course, public health, community, what's happening in communities, what's happening with transmission, what's happening in animals, what's happening in the fauna too. So it's a One Health concept, because the vectors can be in the from the animal space, right? And you can have things also in the environment.
What are the main reasons behind the neglect of these tropical diseases?
Partly to do with who it afflicts. It tends to afflict people in remote communities. Neglected tropical diseases tend to affect people who do not have a voice. They tend to be voiceless. Now, the other thing about these diseases is that they don't kill. They don't have that high impact. Look at COVID-19. COVID-19 came on the scene, affects a lot of people. They are dying. There was urgent action all over the world. Vaccines have been found, new treatment therapies. Like the whole world has just got together to make sure that we deal with this.
And the cynics will say that rich people are dying, so they have to quickly find.
I don't want to say that.
That's why I said the cynics will say that rich people are dying, so they quickly have to find something to.
But because
to stop them
this
from
is
dying.
so silent,
Yeah.
they are affecting people in remote communities, people who are voiceless. They are not killing, but they are maiming. We don't see the effect immediately. They have a long-term effect. Take the soil-transmitted helminths. A lot of children, because of these soil-transmitted helminths, are anemic. What is it doing to their ability to receive in schools? Is it affecting their performance? What does it do to our long-term productivity as a country? So that anemia at primary school level, if we can check it by dealing with NTDs, we may be contributing to our economic productivity in the next 2-3 decades, because those kids will not be anemic. Those kids will be able to receive the teaching they are being given, have the required performance, and be productive in the future.
How do we do you screen for them, these diseases?
So there are two types of NTDs. Those we call tool ready. So there's a drug which we can give to people to prevent them from getting the disease. Those are the preventive chemotherapy diseases. And there are the other ones which are case management NTDs. You need to find the cases before you can treat them.
Which ones would be the case management?
So the case management, borreliosis, leprosy, they are all in that bracket. You need to find the cases. We can sit in our hospitals and wait for the patients to come. But the best way is to look at the data and do active case searches in targeted areas. But that's resource intensive.
Yeah, so you need people.
You need people, you need money, you need resources, vehicles need to move forward, needs to go. And sometimes the resources are not always there. So majority of the cases we find are passive. But that may be just the tip of the iceberg. So we need collective action. We are saying act now, act together, invest in NTDs. As a community, as a country, as a society, we need to place more emphasis on neglected tropical diseases. The same kind of action we've seen with COVID-19, we need to put that in NTDs, because the effect is not present, but is present continuous future.
Has there been any research to show what the impact of these NTDs is on Ghana?
I don't have any to at the top of my head, but I know several researches have been done to show prevalence of some of these NTDs in different areas, the impact on the person in terms of stigma, in terms of the family well-being, and generally they all say the same thing, that the diseases are here. People are suffering stigma. People are being exposed to the negative economic effects of NTDs. So we have enough evidence to act on. But I would say we still need a lot of research in NTDs as well.
How can we improve the situation in Ghana so that these tropical diseases become less neglected?
Less neglected. So if less neglected, we welcome this platform you've given us, and whenever we come on air, whenever the media is a partner in this, we need to inform the public. We need to inform leadership. We need to inform decision makers, because when people are informed, they will place it on the table. Now, we have Ghana Health Service, which is well decentralized, has all its structures across the regions, districts, down sub-district and community. We need to strengthen that system. The same system that delivered on COVID-19, that system also needs to be strengthened for neglected tropical diseases. We need resources. It can come from government, it can come from partners, it can come from the society. The same kind of action we saw in the GIDC, building of the GIDC, we can see that same action for neglected tropical diseases. We ought not to leave people behind. And we are talking about the most vulnerable people in our society.
If you were to rank these neglected tropical diseases, what would be the top 3 in Ghana in terms of impact on the population?
So I wouldn't answer that one because all of them are important. We don't neglect any of them. They all affect our citizens. One NTD is one case too many. One case of leprosy is one case too many. That's where we go from. What I can tell you is that in every district in Ghana, you have at least 2 NTDs. Every district in Ghana. In all the regions in Ghana, you have neglected tropical diseases. So this is a pervasive problem. And this affects persons who are vulnerable, who are probably in the lower income bracket more than the affluent.
Let's zero in on the NTD for which you have responsibility. You're the program manager for leprosy.
Okay.
Ghana Health Service. What's the state of play in Ghana today as far as leprosy is concerned?
Ghana has done a lot of work in leprosy. In 1998, we crossed the threshold for eliminating leprosy as a public health problem. That means that our prevalence went below 1 per 10,000, or it went below 10 per million, more or less. Now, 100 per million. Now we are at about 9 per 100,000. We've gone down further, but we haven't reached 0. So we are still having cases of leprosy, about 260, 270 a year. For the past 3-4 years.
Wow.
Yes, this year, from January to September, we've had 221 new cases. Now, imagine this. Every year we get that number of cases. Every year we treat them. This is a disease that is spread by droplet transmission, just like COVID, right? Now, it takes 2 to 8 years averagely to develop the condition. So it means with one infectious event, we find different cohorts of patients. So cumulatively, we could be dealing with the same numbers. As I said, it's not an immediate impact, but it's a present, continuous future impact. So in Ghana, fortunately, WHO has just recently come out with a new tool, which is the single-dose rifampicin as chemoprophylaxis. And Ghana is one of the countries taking the lead in trying to implement this intervention.
I'm going to break that down for us.
We look for contacts of persons affected by leprosy, household, neighbor, and social contacts who are likely to have been infected. And we give them a drug, which is called rifampicin, which reduces the risk of future leprosy by 60%. And with that, we expect that the curve will go further down and will bring down transmission in Ghana. We want to get to the point where we'll have 0 child cases. When we have 0 child cases, it tells us that there's no new transmission.
What are some of the things that make you happy in the work that you do as far as leprosy and other entities are concerned?
For me, when I find a case, we say case in medicine, when we diagnose someone who has no disability, I am happy. It means the surveillance system has worked well. It means the patient has presented early, and we can cure that individual without disability. Now, when I see patients, my joy comes from my interactions with patients. When I see patients, I'm able to take care of them. They come with very bad reactions, bad complications. We are able to bring them out of it, be able to help them, even work with partners to reintegrate them into communities. There's a lot of joy in the lives of those patients, and it makes the work fulfilling. You know, that's really, really what gives me the kick, what pushes me and motivates me every day to go to work.
Well, I can see it in your eyes, and
Yes.
you're smiling and just thinking about what makes you happy in
Yes.
your work. Let's talk about this World Neglected Tropical Disease. This is the third one.
This is the fourth one.
The fourth one.
Yes.
Okay.
So this is the fourth one, and it is one of those International Health Days which allows us to draw attention towards these neglected tropical diseases. In Ghana, we had a health walk on Saturday. I was part of it. And that was an opportunity to educate the public about...
What was your route?
We went from the Public Health Division offices in Kolebu to the Ghana Health Service headquarters at Tama Station.
What a fair distance.
Yes. And it's also, I mean, keeping healthy. It was good. Then I mean, yesterday we had a World Leprosy Day celebration. The Vice President was there at Wager, and today, later on this morning, at the Ghana College of Physicians Surgeons, we are going to have an event where we would then raise awareness, broadcast some of our achievements, and do a little more of this information and sharing. Even in the regions, you have the NTD coordinators visiting radio stations, the media, to actually also speak about this, you know. And so there's a lot going on around this day to raise awareness.
What is the theme for this year's celebration?
This year's celebration, our theme is Act Now. As I'm saying, we need to act now for the effect of NTD's present continuous future. Yes. And then act together. You have several diseases together, you have several stakeholders, partners, government. We all need to come together. Collective, collaborative action is needed. And then invest in NTDs. It may be time, it may be energy, it may be the media space, it may be money, resources. We need to invest in NTDs, invest in the research, invest to optimize our tools that we have, invest to optimize our strategies, invest to make sure that the healthcare workers, who are motivated, by the way, already, can go out there, find the cases and manage them.
Where are some of the success stories around the world where we have NTDs in Africa, Asia, Latin America? Are there areas where
let's stay in Ghana. Okay. We have had a lot of successes in Ghana. Ghana has been certified free of guinea worm in 2015. In 2018, Ghana was validated as having eliminated trachoma as a public health problem. For instance, I told you that leprosy, the threshold 2, was crossed, and we are moving to the next one. Today, in our event, another achievement will be announced. I can't take it from the announcement. But Ghana has achieved yet another feat in NTDs. Togo, next door, recently they eliminated lymphatic filariasis. They've eliminated three NTDs in the last few years. So there are successes showing that this NTD idea, bringing these diseases together under the brand to bring attention, has led to results. Communities are being given mass drug administration, like drugs. In Ghana, we go to schools, give them safe drugs to prevent the soil-transmitted helminths and schisto, for instance. You know, so things are going on. We are having successes. Yes, even in Ghana. Yes.
Awesome. I haven't heard about Buruli ulcer in a long time.
It is there. We still have cases of Buruli ulcer in Ghana. In the last few years, we've had an integrated strategy to try and find the cases earlier and manage them. Fortunately, the severity of the lesions we are seeing are going down, because it means that people are aware about the disease and we are finding the cases earlier. But the cases are there. Buruli ulcer tends to be in areas where the disruption of soil and water systems, areas with galamsey, areas with mining, areas which have experienced floods, for instance. So we know the hot belts in the country, and we are looking for the cases. But again, a lot more support is needed to make sure we can do the active case searches. The thing about Buruli ulcer and some of these conditions is that people tend to hide the conditions. The patients are hidden in the homes. So if we don't go to the homes and look for them, we won't find them.
Which means your community health people have to be on the ground.
So community health people have to be on the ground, working with community-based surveillance volunteers. That kind of action at community level is essential to find the cases.
We have a message on the board. I want to go read that message for Dr. Benedict Okokwao on NTDs. Alhaji Dawuda. You hope that Alhaji Dawuda from Madina Estate says he hopes the diseases are covered by the National Health Insurance. What's the situation there?
A lot of the complications can be brought under the health insurance, but they are not necessarily as diseases covered under the insurance. Interestingly and incidentally, we celebrate the NTD Day today. Tomorrow for 3 days, all the NTD program managers and other stakeholders are having a workshop with the National Health Insurance Scheme. And the idea is to make sure that every aspect of these NTDs are covered. And that we really are hoping for the best from this, that finally the neglected tropical diseases will be fully and comprehensively covered by NHIs.
Okay, so Alhaji Dawuda, you kind of predicted something, or you had a feeling.
He sort of had a feeling,
had a feeling, yeah, because that meeting starts tomorrow.
Yes,
for
tomorrow,
the next 3 days.
For the next 3 days.
Okay.
And we hope to come out with something concrete at the end of the day.
Awesome. So today's event is at the Ghana College?
Ghana College
What time
of
does it start?
Physicians. It starts at 9 a.m.
Okay.
Yes.
Is it a full day thing or just a half day?
It's a half-day-ish thing, yes.
All right. Okay, all right. Is there anything you want to leave our viewers concerning neglected tropical diseases in Ghana and the celebration that you have today?
Well, yesterday I was at the World Leprosy Day, and our Vice President admonished Ghanaians to open our hearts, open our minds, open our hands, open our pockets, and open our purses. You know, we need collective action against these neglected tropical diseases. For some of them, it is finding the cases. For some, managing, contact tracing, all of that. We need everybody to think about NTDs, support the health service. Even when we come out to do programs, like sometimes there's so much uproar about the drugs we are given in schools. Support us, because we are coming out to help bring down these really, really dreadful diseases, which in the long term turn out to be, yes. So collective action is what I call for, and support. Yeah.
Benedict, thank you so much.
Thank you.
Dr. Benedict Okokwao, Program Manager for Leprosy at the Ghana Health Service. We've been talking about the 4th World Neglected Tropical Diseases Day, which is today. There's a conversation around this at the Ghana College today from 9 a.m. And we wish you the very best in all your deliberations. And happy.
Thank you so much for this.
It's a real pleasure,
Dr.
Kwao.
Yes.
And the little bird tells me that Dr. Kwao and Valerie were classmates years ago. I'm so excited to see her old schoolmate here with us. Yeah, one of the members of the Shark Nation. Forget about Shark. This one is a Shark Nation. Thanks a lot. We've got coming up at 7 o'clock our sports news with Maltiti Saida Sadiq. I come back and speak with Dr. Anane Jinde and Matthias Bonzo Rico Boateng. Kofi Kapita will be in the house as well. We're looking at the headlines. There's a school placement fraud issue that's been discussed by the Fourth Estate. It's an investigation. We'll be giving you snippets of that. There's a very dangerous bridge at Afienya. We'll be giving you a side of that. When we come back after the sports news, you will listen to Stir It Up, Bob Marley and the Wailers featuring Sarkodie. And all the negative energy will counter it with some good energy here. You'll see where people are giving him love from all around the world. So Ghana people, look sharp. All right? Our movie time on GTV begins next week on the 6th of February from noon, weekdays. Enjoy your lunch and feed your eyeballs also with movies, Ghanaian and African movies. Movie time, weekdays on GTV from noon, and then on weekends it's from 11 a.m. Note it in your diary. You stick around. This is GTV Breakfast. My name is Kafui Day. 30th January, a very significant date. I'll tell you about who was born on this day and what happened.